My name is Paula, and we're just going to sit and chat. I'm here with another worker with our company, and we're just going to talk about things that we've experienced in the world of care and communities.
Hi, I'm Dana. I came to long-term care in a roundabout way, but for the last 17 years plus, I've been working with an elderly population in assisted living.
All right, well, we are both very passionate about this, and I think when we do our trainings, that comes out.
Yeah. But we could talk about technology.
But before we talk about technology, I just want to say that there is a difference between cognitive decline and dementia, and only because I have witnessed people writing down, oh, they have dementia, asking, did you get a diagnosis for this? No. Well, why do you have dementia? Well, because they're losing their memory. Okay, there's a big difference, though.
Or because they're old.
Or because they're old, yes. And it's not true that everybody that ages is going to get dementia.
Well, and we can talk about technology, or we could go to, which we weren't going to, but
your turn.
When you said aging at home, I got really excited.
I did too. I know.
There is so much being developed to actually give people the independence to stay in their home longer. That they're designing smart homes. There are wearables. There are robots, not like the robot, that cleans your house, but mechanical ways to get your medication and not overdose and to ensure somebody took it. Very exciting time to be living in for the fact that you don't necessarily have to move into a facility.
Right.
And the companies I've worked for that are long-term care communities will not like that we're talking about that. There's room for everybody.
Right.
Somewhere.
Something that we can hope out of this, because there are going to continue to be homes and children will continue to place their parents in them, is that we can try to be that element of what it's like to be at home. Right. We can provide that to people, and it's not impossible.
Yeah. And that's been another kind of shift in long-term care is going from places that look and feel like a hospital, and they call them patients, the people who live there. I don't go into the place where I live, to be treated and recover. If that's my home, I go there to live.
Right.
I'm a resident of the place.
Okay. Patient is a buzzword for me.
I know it is.
Yeah.
That's your pet peeve.
It is my pet peeve.
Which it should be.
Yeah. Because I have been a patient before in a hospital, and I see myself as really independent. I like my autonomy. And when I knew I was a patient, I did not like it one bit. I couldn't wait to get out of there because, inside I'm screaming, hey, I'm capable. I can do lots of things. I've worked all this time. I can, and so I did not want to be a patient. Patient needs to get fixed.
Right.
So when I was in the hospital, I was there because I had to get fixed. I don't want to be a patient in my own home. Right. I want to be a resident of mine.
And when you were a patient, you may have overheard people referring to you by your diagnosis.
I did. Yes.
Yeah. You're not an individual. You're the broken bone, or
I'm the
congestive heart failure, or the cancer, or whatever.
Right.
So in assisted living, we've really tried to get away from people wearing scrubs to work. Do you want people in your home who look like a nurse?
I just said this the other day in a class. It was actually initial. And they were all so disappointed in initial. And
they said, assisted living.
Right. Yeah. And some of them said, oh, wait. What about when somebody has the runs, or when somebody throws up, or they make a mess? They're going to mess their own clothes? I would prefer people wear scrubs. If people do mess up their clothes, I guess you can wash them.
Yeah.
I don't know. I worked in ARF and I never wore scrubs, and I did clean up a lot of messes.
And there are comfortable outfits that you can wear where you can move and bend and do things.
Right. Yeah. And it doesn't look like a hospital or an institution.
And but on terminology, do you want to
terminology?
Yeah. So we don't call people patients.
Right.
Both of us correct people every time we're doing one of these classes, and somebody says, my patient. And there's another reason not to call people patients, which has come up. I think we've talked about it.
Yeah.
When an individual is the administrator or a director in the community, and you're a nurse, it's really hard for nurses to get out of the habit. Right. If you're talking to a healthcare provider like a doctor or a pharmacist, and you say, my patient needs da-da-da. Sometimes, and doctors, discharge planners, case managers don't always understand what we do in non-medical care. And if you call the person your patient, they think it's a medical facility,
Yeah.
and they can issue medical orders that we can't follow in assisted living.
Same thing happened with me when I was doing a correction. That's exactly what happened. She had stage 3 pressure sores, and she kept talking to the doctor and saying, but I can't take my patient back. And he would say, yeah, I gave you doctor's orders and I have a care plan. Take them back. But I can't take my patient back. And that was the problem. The doctor insisted. So she thought, well, if the doctor is insisting, then he must be right. I'll take them back. And guess what? She gets a big citation because she's got people in her home with stage 3 pressure injuries. So if she had said, my residents, this is not a medical facility, this is not a skilled nursing home or anything like that, this is social model of care.
Yeah.
So I don't know why people are stuck on the word patient.
Long habit.
Yeah.
And for some people, they come out of the medical field because they have a passion for caring for elderly or disabled people.
Right.
And they love their patients, but they're not patients.
They're not.
They're not coming to us to be fixed.
Right. Exactly. So talking about that term, challenging behaviors, because I hear this all the time. And if we could change that term, challenging behaviors, what would we change it to?
Still behavioral expression.
Okay.
Who are they challenging? You because you're trying to get something done and they don't want to do it? Are they hurting themselves? That's definitely a challenge. But what are they doing and what are they expressing that we need to help them with?
Yeah, it's a challenge to the person who's trying to do the work or the task, but it's a fear or a misunderstanding for that resident. So we don't understand Paula's communication, rather than Paula has some challenging behaviors.
And it feels different to you when you're talking about yourself, and that's person-centered.
Right.
The majority of the time, it's being patient and treating them like, smiling at them, talking to them.
Right.
But I don't know what your person. You have to try different things. Right. Sometimes it's not rocket science. I had a resident one time who had these bad episodes in the afternoon. He was kind of pacing around, exit seeking, didn't want anyone to mess with her. She didn't want to do any of our activities. And one time she was screaming at the staff, get away from me, get away from me, get away from me. And I come out of my office and she's got 5 people surrounding her going, come on, no, stop, come over here, relax. And I was like, guys, she's speaking English.
Right.
Get away from me.
Get away.
What more do you need?
Right.
What we needed was to, withdraw.
Right.
Watch her from a distance. She was okay. She would walk around in the parking lot, which was fenced. We just need to keep an eye on her.
Right. I told a story about he was in a home and there was a gentleman who fell on the floor and there was a bunch of staff around. So they all ran towards him. He was on the floor and they were all trying to get him up, pull him up. And he was then yelling and throwing his arms at them and throwing fists and screaming. And they didn't stop because this just, alerted them even more. And they were trying to get him off the floor, thinking that all this screaming and fist throwing is because he's on the floor. There was the doctor that was still in the home at the time. And he went over there and he said, everybody back away. And what he did was he got on the floor next to the gentleman, laid down next to him, and he just said, hi, Al, how you doing? He goes, not so good, doc. And he goes, all right, we'll just stay here until you're ready to get up, but you let me know when. And then he said, I'm ready to get up now. And so the doctor gently helped him up. Mm-hmm. So yeah, it can, when you're on the other side, it can be very upsetting and shocking.
That's a typical reaction from a lot of caregivers.
Right.
Is fix the situation.
Let's talk about exit seeking.
Exit seeking. Yeah. And now we're differentiating between unsafe wandering and elopement.
Right.
I don't know how much it matters.
Because there's nothing wrong with wandering.
Right. If you lose somebody, that's a bad thing.
Right.
We can all pretty much accept that.
Right.
But yeah, sometimes people wander aimlessly. Sometimes they wander safely, which means maybe they're going in a place where they could get hurt.
Right.
Or more often they're going into somebody's room and, the
getting
roommate
stuff
or another resident is getting upset by their behavior.
Right.
They might need exercise. They might be wanting to leave. That's a natural, normal.
I want to go home.
Yeah, people want to go home.
Yeah.
How can we redirect them? How can we discuss that? How can we maybe take a walk with them. I've had residents who they want to go outside and we just go along with them and we walk them around the block and then we say, hey, let's go in here. And they come right back inside.
Right.
You know, because of course we tell caregivers, you don't argue with people, you don't say no.
Right.
But the pacing could be a million things.
Yeah. We're trying to figure out, how do I get this resident who's in my care to do this thing? And I might have already said this the last time, but I'll say it again. So there was a home that I know of, but what they did was it was a home with 4 women, and none of them liked to take a shower. So there are reasons people don't like to take a shower. A lot of times the water pressure hurts, it stings on older skin, thin skin. So even for people that are in 80-degree weather, you know, they can still say, honey, I need my shawl. It's cold, right? So they don't want to get dressed because it's cold. So what this house did was brilliant, I thought. The woman who was an administrator decided to turn this into spa time. And so she got a heater for the bathroom. She heated up the bathroom. She put her robe in there. She got some essential oils, incense, and she put on something like spa music, as well as those candles that are battery operated, but they look like real candles. So she lit up the bathroom really nicely. And so she said to the leader of the 4 women, you know, Edith, come on in. We have spa time now. It's a new thing. I want you to try it out and tell others how you feel about it. She said, okay. And so she gets in there. The bathroom is hot. So hot, you might want to take off your clothes, right? So she gets her to undress, but Edith's like, oh, this is really nice. I like the candles and it smells so good. And so she said, yeah, let's just start with your feet. And so she gets her into the shower. She gets her to take her clothes off. And she says, let me just start with washing your feet. By the time she's finished, she's completely showered. So she goes out in her robe and she says, girls, guess what? I got to try this spa and it's wonderful. You're going to love it. And so it's been already 3 years. And I've talked to her again and she said, no, they only have spa time. There's no such thing as shower time in that. And you're talking about connection. And when we were talking earlier about exit seeking, we were talking about how typically a person says, I want to go home. Well, I thought about this because my grandmother, who died at 102, used to say the same thing. I want to go home. I want to go home. But the truth is, she forgot that she had a home. She didn't remember anything about her home. And when I would ask her something about her home in Whittier, she'd say, oh, honey, no, I live here. So she didn't remember that she had a home. So then what is it that they want when they say, I want to go home? Well, it's that element of care, connection, love, feeling safe. Somebody's talking to them, right? Not just doing their job, but actually talking to them. Yeah. Why not? Why not sit with a person and say, you know, I'm going to bring you a cup of tea. How have you been doing lately?
Home is where maybe you have family and they care about you.
Right. It's where they feel safe, wanted, comfortable.
If you're not providing things for people to do that appeal to them, that's doable, that makes them feel engaged, they're bored.
Right.